Hi, I'm Dr. Choi, board certified periodontist since 2011, and today I'm taking you behind the scenes of one of our most challenging cases yet. We have a patient who drove up all the way from Houston for immediate dental implants. That means we're removing her teeth and placing the implants in the same visit. But here's what makes this case so interesting. She has what we call a thin biotype, extremely thin jawbone and gum tissue. This might sound like a nightmare scenario, but it's actually the perfect teaching case because it shows you exactly why proper technique matters. Now here's the scary truth. Most dentists, unfortunately, don't even know what a thin biotype is, let alone how to treat it properly. They take one look at this case and think, young patient, healthy teeth, let's just put in the biggest, strongest implants we can fit. But that's exactly how you destroy a patient's jaw. When you force oversized implants into thin tissue and thin bone, you're essentially guaranteeing peri-implantitis and bone loss within a few years. What looks like a simple case to most practitioners is actually a ticking time bomb for the patient. See, anyone can slam an implant into thick, healthy bone, but when you're working with challenging anatomy like this, every single decision becomes critical. One wrong move, and instead of lasting 60 plus years, these implants could fail catastrophically, and the revision surgery becomes a nightmare that's exponentially more complex and expensive. So today I'm going to walk you through our entire thought process, from the 3D scan analysis to the final sutures, showing you exactly how we transform a high-risk case into a long-term success story. Hey, good morning everybody. Today we have an interesting case for you. We have a patient that drove up from Houston for some dental implants. This is a little bit of a unique case because what we're going to be doing on her is we're going to actually be taking out the teeth and placing the implant at the same time. So this is what we call an immediate implant. But what's interesting about this case is that she actually has what we call a thin biotype, meaning she has a very thin jawbone. So I'll show you the 3D scans and kind of show you like what our thought process is in regards to how we're gonna attack this case. But we've just literally started the sedation process, and this patient is willing to let us kind of show you through her journey and her process. So once we get her a little bit more sedated, we'll number up and get started. All right, so basically what's interesting about this case is that I mentioned earlier that she has very thin bone, but when we have thin bone, the other problem that she has is she also has thin gum, okay? And so this is what we call a thin biotype patient. And one of the issues with having thin biotype patients is it's easy to get dental implants in a patient like this on day one. But what we're most concerned is about long-term longevity of the implants. This patient is only 24 years old, so we're placing some back teeth, molar and premolar implants. But how do we make sure that, I made a video recently, and one of the doctors that gave a lecture at a recent conference, he was talking about dental implants shouldn't be viewed just as a kind of like a 5-year like success or 10-year success. How do we basically have multi-generational success? So can we get her into her 60s, 70s to 80s, potentially to the grave one day, not to sound morbid about it, but without having any dental issues? And while we can't necessarily promise that, she can go the next 60 years without ever having issues, but we can strive to have that. And one of the best ways to do that is to make sure that we thicken up her bone and her gums, make sure we transform her from having a thin biotype to a thick phenotype. And so we're going to achieve that by several methods today. We're going to make sure that we take these teeth out. Step number one is we take these teeth out atraumatically as possible, meaning we take the teeth out as carefully as possible, not traumatically. And the way that we're going to achieve that is that we're going to be careful about how we get in there. We take the teeth out. One of the issues that I see right off the bat is on her 3D scans. She has large molars with big roots. So any tooth that has bigger roots is going to be more difficult to remove. And another thing is also we're looking at basically how thick the roots are, how divergent they are. And we almost need to view them almost like as anchors in the wall, right? So if I'm pulling out these anchors, like these screws from the wall, and they're like together, or they're fatter screws, or they're divergent screws, how do I take those out without taking as much drywall and tearing up the drywall, right? And so that would be my best analogy. So step number one, preserve as much bone as possible, by meaning taking out the teeth as carefully as possible, meaning we can use piezo surgery units, meaning we can section teeth and just be as careful as possible. And so also, after we take those teeth out atraumatically, then we need to properly size these implants. Like, unfortunately, one of the things that I see is that there's a lot of clinicians out there that are going to try to place as big of an implant as possible because they have the ideology this patient's 24 years old. I want to make sure that these implants last the next 6 years. So I'm going to stick big fat screws, these big anchors into the ground, right? Or in her example, into her bone. But as we mentioned earlier, there's a lot of data and research that's been out for decades now that said, like, if you stick too fat of an implant and don't have enough thick enough bone or gum around that implant, you are actually going to do more damage than good. So what you're going to do is you're going to cause basically bone loss, tissue loss, and therefore what we call periimplantitis that will develop. And that's actually going to like probably take a few years to develop, but it will develop, right? So the way that we can prevent that from happening is we can use narrower platform implants, meaning just skinnier implants. But the problem is that we're placing these implants on her back teeth. And so what we don't want to do is we don't want to place too skinny and too short of an implant, because we also need to be concerned about her inferior alveolar nerve. We don't want to place too small of an implant, because if we do that, when she's biting down with force over all these years, what we call parafunctional habits, clenching, grinding, just normal functioning of her teeth, she can actually lose her implants because there's too much force on those implants. So what you're trying to do is you're trying to find a happy medium where we can get an appropriate sized implant. And what we're also going to do, step 3, is we're going to do a lot of bone grafting. So there's many different types of bone grafting. I highly recommend you watch one of my videos where I talk. It's like 40 minutes. I know it's a long video, but bone grafting sounds like a simple concept, but it varies significantly in regards to its different modalities for achieving bigger bone, right? So in this example, we'll be basically doing guided bone regeneration, where we're going to be going in there and we're going to be adding all this bulk of bone on the outer edge, and then also basically on top, more of what we call like filling in the defect, or what we call like socket preservations. So we're going to be doing extensive bone grafting. And then final step. One of the issues, as I mentioned earlier, is that she has thin gums. And that's again one aspect of having a thin biotype. So what we're going to do is we're going to go ahead and add some gum. So unfortunately for her, because she has the thin biotype and I can't get enough tissue from the roof of the mouth, using autogenous tissue from the roof of the mouth is always a great source. But fortunately for her, we have other options available. And today I'm going to be using microderm on her. So I'm going to be, after I add on all that bone, I'm going to go ahead and thicken up her tissues for her today also. So all these steps are going to be necessary steps that we do to achieve, hopefully, long-term, like longevity for her dental implants. Again, by taking the teeth out carefully, properly sizing the implant, not going too wide, adding necessary bone graft, then also thickening up the gums. And I know that sounds a lot, and I wanted to go through this entire process because, again, if we don't go through this like minutia of details and we just randomly take teeth out and just slam some implants in there, they look great and they're not going to give her any issues for a few years. And then literally a few years later, she gets periimplantitis, all hell breaks loose. And the problem then is, because I see cases like that come in, unfortunately, the problem is not so simple of like, the solution is not so simple of just taking those implants out and just placing new implants. It unfortunately becomes way more complex. So, and more expensive, unfortunately. Okay, so what we're gonna do is we're gonna get her sedated and we're gonna get started with her procedure. All right, so I'm starting off on her right side, and she lost a tooth, her number 30, which is her first molar on her right side. She lost that a while ago. So as you've probably seen in some other videos, when you lose a tooth, the bone thins out in that area. So we are going to place an implant on tooth number 30 with the first molar. The tooth on 31, which is the second molar, which is tooth behind it, we're gonna actually just take that tooth out because most people don't even need it. So she could save that money, some money that way. Now, when I'm doing this, I'm actually gonna go ahead and I'm gonna start by actually making an incision in the gums and pull the gums back. Some people might say, well, why are you doing that? Well, I'm bone grafting anyways. So what I'm noticing right off the bat is that she does have very thin bone there. We are seeing definitely this tooth, number 30, which has been missing for a while, the bone's thinner. So I'm going to definitely have to go in and augment that bone in that area. And in this area also, again, I'm just gonna be very careful taking the teeth out, and I'm gonna bone graft that area. We took them out very carefully, but because her bone is so thin on this outer edge, this is actually where one of the implants are going to be going. But if I don't properly, this is exactly why you need to like reflect these gums back. If I'm not careful, then, and I don't do efficient bone grafting and it like doesn't do well over here, then this is going to compromise this patient over the long haul. And so I want to be real careful. Now,
Also, what's a little bit deeper under here, I'm not going to go digging for it, is her inferior alveolar nerve and where it exits onto the gums, the mental nerve. So I'm also going to have to be very careful when I'm going to go ahead and drill and place that implant. So just wanted to show kind of like what it looks like down here. All right, so we got both implants in. You can actually see these are, ignore the green parts, those are just what they call transfers. We're going to disconnect those in a little bit. But you can actually see the titanium screw embedded within the jawbone. And so I didn't use, again, like very large implants. I wanted to properly size them so they're not super thick. Remember, this is the bone that was too thin in this area. So I used something called VersaBurs to kind of like not go in and traumatize the bone. But as I mentioned earlier, now what I'm going to do is I'm going to go and build up all this bone on this outer edge, and this outer edge too. And then I'm going to lay something called membrane on top of that. And then on top of that, I'm going to put the microderm gum graft.
Okay, so we finished the right side. Everything went great. What we did was we added the bone on the outer wall also. Then we threw some membrane on there. And then also I added that microderm gum graft so that we can help thicken up her gum tissues. And so when we add on all that bulk, one thing I didn't show you guys, but just wanted to mention that's important, is that when we add all that bulk, I tell people, like, when you're adding bulk, bone, and gum, what ends up happening is that I tell people it's like if I was to gain 50 pounds in my gut overnight, my shirt won't fit, right? So the way that we achieve, well, what's very important is that the gums need to close. So it's going to be more difficult after you add all that bone in the gums to be able to close that area. So what we have to do is we make a special incision in the area called a periosteal release. However, which is very important, you have to do it. However, the downside is that it does cause a lot of swelling. Also, you have a major nerve called the mental nerve emerging in the area that we got to be very careful to work around. Otherwise, you can get some very serious numbness down in that area around the lip and chin area on that side. And also, again, you want to get good closure in that area because otherwise your implant can have issues, or the bone graft may not integrate. And also, if you're doing outer wall bone grafting, the guided bone regeneration, that's not really going to take as well. So it's very important to close up that area. So we did that. We sutured her up on that side with a suture that's going to last there for the next month. Now we're going to move on to the left side. So with this left side, I do notice that her bone obviously is also thin on this side too, but her root formation is a little bit more acting like anchors, so it's going to be more difficult to remove these teeth. Couple that with the teeth on this side are more heavily broken down, and so the more heavily broken down they are, the harder they are to remove intact. And the harder they are to remove intact, it then requires, they basically, the teeth will start crumbling as I take them out. I tell patients an example of like a rusty pole. If I'm trying to remove it from the ground, I want that pole fully intact. But if it starts breaking and it's too rusty and it's, then I have to remove more soil or concrete to get the rest of the pole that's submerged in the ground out. Similarly to this, if there's too much tooth structure that has too much decay or it starts crumbling when I take it out, then what ends up happening is I remove precious bone to get the remainder of that root out. Now, people will then say, can't you just bone graft it and it's super easy? It's not. And especially when we're doing immediate implants, we got to be very careful because we need bone preservation, and then we're going to also add bone on top of it. But if it gets really bad and there's too much bone loss, native jawbone loss, then what we have to do is we say, hey, you know what? We're just going to bone graft this, and then we're going to bring you back in the future, and that's where we're going to go ahead and place your implants. So if we want to do an immediate implant, something that's very key is, again, we have to have an atraumatic extraction. Some people who have thicker jawbone and a lot more wideness of the jawbone to play with, those patients, we have way more leverage to basically go in and drill the tooth out and have no problems. But again, the more basically the thinner the bone is, or the more compromised the teeth are, and then you couple those two together, you have more eggs in one basket where things can't go wrong. Everything needs to align. The stars need to align for her to have a good outcome from this. So knowing that, I'm about to get her procedure started on the left side, so we'll cross our fingers and hope that we can get those implants today. Okay, so that surgery is all wrapped up. I just wanted to give you guys a glimpse into what it's like whenever a patient has a dental implant that may be perceived to be an easy case, but as I showed you there's a lot of considerations that actually go into it. So just to kind of wrap it up, I didn't want to show you guys all the little details on the left side. It was actually a little bit easier than the right side. I mean, it was actually a little trickier getting the teeth out atraumatically, trying to do as little damage to the surrounding bone as possible. But yeah, it was actually easier. And then we did an immediate implant where we took out the tooth and placed the implant at the same time on that molar, which is a little bit trickier than a lot of other sites. So anyways, that was our little glimpse into what it's like when we're doing dental implants. So if you guys have any other questions, feel free to leave them in the comments below. Thanks.